Hi everyone, welcome back to my channel, and in this video I will explain about the humerus bone, its introduction, site determination, clinical features and muscle attachment. So without further ado, let's start. First is introduction of the humerus bone. Humerus is the bone of the arm and it is the longest bone of the upper limb. Second is site determination. Site determination is very important for the viva. In the viva external ask first question is that which side of this bone tell me. So first is that upper end is a rounded and lower end is a flat. First point is upper end it is a rounded and lower end is the flat and olecranon fossa it backwards. So these 3 points, first, second and third, we can identify which side of this bone. So this is the right side of the humerus. So now the features of the humerus, it is called the upper end, this is the lower end and this portion is called the shaft and on the upper end there are two tubercles. First is lesser tubercle and second is greater tubercle and between this tubercle this portion is called the intertubercular sulcus and there are three neck on the upper end. This is the surgical neck. Surgical neck separates the upper end from the shaft. This is the anatomical neck and third is the morphological neck. So this is the features of the upper end and now second is the shaft. Shaft has a three border, three surfaces. So first is the medial border, lateral border and this is the anterior border. Anterior border is a shaft and it has a three surfaces. So medial side it is called the anterior medial surface and lateral side it is called the anterolateral surface and third is the posterior surface of the humerus. And now the lower end. So on the medial side it is called the medial epicondyle and lateral side this is called the lateral epicondyle. And this is the trochlea on the medial side and the lateral side it is called the capitulum. Trochlea is a pulley shaped and it articulates with the trochlear notch of the ulna and capitulum articulates with the head of the radius and there are two fossa on the lower end. So medial side this is the coronoid fossa and lateral side this is the radial fossa. It is the medial supracondylar ridge and on the lateral side this is the lateral supracondylar ridge. And this tuberosity is called the deltoid tuberosity. Deltoid muscle is inserted on this tuberosity. So this is the all external features of the humerus. And now the attachment of the muscles on the humerus bone. So there are three muscles is inserted on the greater tubercle. First is the supraspinatus is inserted on the upper impression of the greater tubercle and middle impressions पर infraspinatus and lower impressions पर teres minor muscles का insertion होता है and lesser tubercle पर only one muscles का insertion होता है. It is called the subscapularis muscle. And medial lip of the intertubercular sulcus पर teres major muscles का insertion होता है and just lateral lip of the intertubercular sulcus पर pectoralis major muscles का insertion होता है and between these both major muscles on the floor of the intertubercular sulcus latissimus dorsi muscle is inserted. So medial lip पर teres major, lateral lip पर pectoralis major and floor of the intertubercular sulcus पर latissimus dorsi muscle is inserted. एंड डेल्टोइड ट्यूबरसिटी पर डेल्टोइड मसल्स का इंसर्शन होता है. So this is the all insertion of the humerus bone. And now the origin of the muscles. So brachialis muscles is originated lower half of the anterior medial and anterolateral surfaces and brachioradialis muscles is originated upper one third of the lateral supracondylar ridge and lower one third of the lateral supracondylar ridge extensor carpi radialis longus muscle is originated and the pronator teres muscle is originated lower one third of the medial supracondylar ridge. And next is that common flexors is originated medial epicondyle and common extensor originated lateral epicondyle. And next is that the triceps brachii has a three head. So lateral head is originated from the above the this is the radial group This is the radial groove. Above the radial groove, lateral head of the triceps brachii is originated, and below the radial groove, the medial head of the triceps brachii is originated on the posterior surface. And one muscle is anconeus. It is originated lateral epicondyle of the humerus on the posterior surface. This is the all origin and insertion of the humerus bone. And this video is helpful for you, so follow for the more.